On behalf of my co-authors, I am pleased to present our analysis of national claims data looking at breast cancer diagnosis and treatment before versus during the COVID-19 pandemic. The COVID-19 pandemic had a major impact on healthcare, including cancer screening. Mammographic screening dropped by about 90% in the first few months of the pandemic, recovering by July 2020. Guidelines issued early in the pandemic suggested considering neoadjuvant endocrine therapy for many estrogen receptor positive, HER2 negative breast cancers. Our aim in this study was to understand the impact of the pandemic in the United States on breast cancer diagnosis and first treatment after diagnosis, over time, across geography, and by race and ethnicity. Our data source was the Optum Research Database, consisting of claims records from multiple United States health plans linked to information derived from the electronic health record, including race and ethnicity. Optum included about 30 million adult health plan enrollees between February 1, 2017 and January 31, 2021, the dates of our study. In each 4-month period over this timeframe, Optum included about 7.4 million individuals aged 18 or older with at least one claims code and no prior diagnosis of breast cancer. This population was majority white, and there were enrollees throughout the United States. We defined a breast cancer diagnosis as a first ever ICD code for breast cancer with a concurrent breast diagnostic biopsy procedure code up to 6 months prior or 3 months after that ICD code, with date of diagnosis defined as the date of the biopsy procedure code. To determine first treatment after diagnosis, which we classified as either endocrine therapy, chemotherapy, or surgery, we searched claims for 60 days after breast cancer diagnosis. Our primary endpoints were the incidence of breast cancer diagnosis and first treatment, which for the purposes of the logistic regression, we classified as either surgery or neoadjuvant systemic therapy. Our covariates were, first, time of diagnosis, either pre-pandemic or one of 3 4-month periods after the onset of the pandemic. Second, either race and ethnicity or geographic division, which we defined according to the 9 Census Bureau divisions. And third, the interaction term of either race and ethnicity or geographic division with time of diagnosis, allowing us to learn whether the impact of the pandemic on our primary endpoints varied according to these factors. Here are our results. The monthly incidence of breast cancer diagnosis dropped acutely by about 40% in April and May 2020. There was some recovery in June and then full recovery in July, though notably those missing diagnoses from April and May are not yet entirely accounted for. In our second endpoint of first treatment after diagnosis, we saw a rise in the use of neoadjuvant endocrine therapy, starting with patients diagnosed in February 2020 and peaking in patients diagnosed in March 2020. There was a smaller rise in the use of neoadjuvant chemotherapy as well. Again, the distribution of first treatment after diagnosis returned to baseline by July 2020. When we looked at the impact of the pandemic and whether it differed by race and ethnicity and by geography, we found that the rate of breast cancer diagnosis after the pandemic reduced and recovered differentially across races and ethnicities and across geographic divisions. The use of neoadjuvant therapy increased and returned to normal differentially across geographic divisions. Here we see breast cancer incidence cumulative across each 4-month period over the course of the pandemic by race and ethnicity. All groups experienced a reduction in the rate of breast cancer diagnosis at the beginning of the pandemic, with that initial reduction being the largest in the white population. Where the differences between groups were greatest was in the recovery. For white and Black women, there was an immediate strong recovery. For Asian women, the recovery was comparatively delayed, while for Hispanic women, it had not yet occurred by January 2021. Here we see use of neoadjuvant systemic therapy for each 4-month period across the pandemic by geographic division. The pattern of initial increase followed by return to baseline was stable across regions with relatively little differences between groups in that return to normal. Here it is the degree of the initial increase that is variable between regions. The increase in the use of neoadjuvant systemic therapy during the early months of the pandemic was the greatest in the Middle Atlantic, in yellow, and New England, in orange, at 5 to 6-fold, and smallest in the Mountain region, in green, and the South Atlantic, in red, at 2 to 3-fold. In conclusion, in this population of individuals with insurance, in the early months of the pandemic, there was a large reduction in the rate of breast cancer diagnosis and a large increase in the use of neoadjuvant endocrine therapy and, to a lesser extent, neoadjuvant chemotherapy. These changes reverted to baseline by July 2020. The patterns of change and recovery across the pandemic differed by race, ethnicity, and geography, highlighting disparities in the pandemic's impact on the population. This concludes my presentation, and I would be very happy to take any questions you may have.